Many people talk about the ups and downs of married life, but no one really prepares you for life after your spouse passes away. Welcome to Widowhood Real Talk with Tina, a safe place for widows, widowers, and their friends and family to talk about love and loss. Find comfort as you listen to honest conversations between Tina and invited guests who've experienced the loss of their forever partner. Share their stories of love, grief, and healing. You are not alone in this journey. Join today's episode and discover a wealth of resources and learn how to connect with others who are traveling the same path. This is Widowhood Real Talk with Tina.
Hello, Jessica. Welcome to the Widowhood.
Hi, thanks for having me.
She says slowly, like, I don't know. So I want to tell the Widowhood community, this is a 4-part conversation. So I'm leave it at that. You're going to have to invest to hear the other 3 parts to see what else is going on. But let me tell you, this is my first 4-part conversation, and it's going to be worth your time.
Yay.
Yeah.
Unique, right?
Oh, worth your time, all of that. So we met, I saw you on TikTok, and you were sharing about the mental health professional. So what space do you operate in mental health?
Yeah, so I got my degree in clinical mental health counseling, and after 2 different exams and a bunch of time being observed, I'm a clinical mental health counselor, and I work with kids in a school-based therapy setting for one of the children's hospitals in the nearby area.
Okay, that was a lot in one sentence. So I'm going to circle that back.
Yes.
So mental health counselor.
Yes.
For someone that has no concept, what do those terms mean and why would I want to connect with you?
So with clinical mental health counseling, we take a holistic approach. So every part of your being versus, and there's nothing wrong with any of the different branches of mental health, but like psychology is very clinical, very all about the diagnosis. While I'm going to be working with what's going on in your life, how is that impacting you? Talking to kids about the whole family unit and how that's, generational trauma and things like that come up and how that's impacting them on the daily versus just looking at a diagnosis, what a kid's going through, giving them medication. It's more about understanding them through the counseling process and talk therapy.
Thank you. And so you actually went into the next thing, popular term, talk therapy.
Yes.
What is talk therapy in comparison to what it is that you do?
Well, so I'm a cognitive behavioral therapist, which when I'm explaining that to people, it's basically the things that we think and the things that we feel impact our overall decision making. And so applying that to what's going on in a person's life versus, I think really talk therapy is different for everyone because there are different theories of counseling. So you might have somebody who goes more like psychoanalysis, which is like the old Freudian stuff.
Right.
And then there's DBT. There's a lot of different ways of doing counseling. CBT is really evidence-based. So it's why I went with that. I think I also have a person-centered approach a little bit. And so it really is about trying to figure out the dynamics of it and how a person functions on a daily basis through their thoughts and their feelings, and also being able to help them alter that. I don't know if I explained that 100%, but versus
I know the term talk therapy is very popular.
Yes.
So you ended with that statement, but I wanted to branch out on that a little bit more. And the reason being, there are a lot of different ways that you can be helped with your grief. Sometimes people hear therapists and put that in a broad sense bucket where there are a lot of different avenues for people that have different fields of specialties to be able to operate, like a therapist versus a psychiatrist or a psychologist. A lot of times people are grieving and hearing terms that they're unfamiliar with and not certain what professional they need to work with. So as we're having this conversation, those different types of mental health professionals, from your perspective, what are the different titles or categories that people may want to make themselves more familiar with as they're trying to go, do I need somebody to help me? Because I've been able to do everything else myself. But now it's a long time has passed and I don't feel like I'm any better. People told me in time will pass and you'll be fine. People told me that you don't have to talk about this all the time to everybody, but yet I feel stuck. And now I'm thinking, I hear this conversation about mental health. Where do I want to start and what type of mental health person do I even want to talk to?
Right. So I think that is a really good point to bring up. I'll break down what you kind of said before. Psychiatry, you're probably most likely going to talk to them for 15 minutes. You're going to get medications prescribed to you. They're going to do check-ins with you every month, 2 months, 3 months, whatever they're giving you as far as medication. Psychology, like I said, is more medical based. So they're going to understand you through your diagnosis versus you as a person and then your diagnosis, which is where counseling comes in. And we look at your whole life and how your diagnosis is being impacted and how it's impacted you. When it comes to grief, I personally went through the hospice offered free counseling to me. So I engaged in that as quickly as possible after losing my husband. And so he died in October. I think I started in November, immediately started with this person every week. And then slowly over time, that kind of spaces out. So you'll see that things slowly less need is available. Not all of the time. The therapist and the person who's doing therapy is going to make that decision, but that person was specifically a grief therapist. So if you're going to look for somebody, I would look for somebody who has a specific concentration on grief and trauma. Because I'm a big believer that if you've been through this process, you have had some level of trauma. You feel it all the time in different parts of life, in your body. I've talked about that a lot on TikTok is your body's response to trauma. I know that happened to me even before my husband passed away because his was a terminal diagnosis that he lived for almost 3 years. And reading through my journal and going like, oh, that was grief. My body was physiologically responding to grief. And I didn't realize it. Even as a person who was a mental health therapist, I was just like, oh, I'm sick all the time. And I think I'm overwhelmed by what's going on without realizing like the mind-body connection. So I think having a grief therapist is really important because they're going to recognize that, but they're also going to let you just talk if you have a good one. But like, here's the thing. I hear horrible stories all the time. Not everyone is the right match for a therapist. I think some therapists want to challenge people with grief versus letting them sit in grief. So I think having somebody who is specifically a grief specialist is so important for that reason, because a typical therapist is not always going to let you be in your grief. And sometimes you're going to want to have the challenge because they're going to push you beyond what you're comfortable with. And when you get there and you're comfortable with your grief, that's when I think the healing begins. So trying out therapists like clothes is actually totally preferred. I tell all of my people that I work with, at least when I was in private practice, it's a little different now because I'm in school-based. They're kind of given to us as we go. But it's more important to me that you find the right therapist than you staying with me. So if it's not working, let's find you the best person possible for you to work with.
Thank you. I'm not sure which way I want to go, but I'm going to go with this one first.
Okay.
I'm trying to find a therapist. What are some things how do I find out if they're the right one for me? And girl, hold on, let's go back to those nails with the things going on. Let's see what that is. Okay. So cute.
No, they broke, so I had to go get different colors because
Are they press-ons or do you go to the shop or?
So literally since losing my husband, I started doing SNS because I was a nail biter and it's the only way I can keep my nails. So these are SNS right now, but
what is that?
Yeah, it's so like the same stuff that they would put on top of like a fake nail, but it's a different, I guess, like different whatever.
Okay.
And so they put it on top and it just keeps it super strong. So when I just run into stuff and grab things and like hit my hand all the time, I'm a super klutz. They keep them stronger so that they don't break.
Okay.
Not so much.
Just got blinded. I've been doing press-ons. I like nails, but good gosh, the amount of money it costs to go get these, girl.
I know.
I'm like, I'd rather go out to eat. So I purchased some press-on nails, and this was like my first time doing it. One of my coworkers has them, and she told me where to get the glue, and I got this at like a regular store. And I was like, for 2 packs or whatever, I was like, yeah, we good, we good.
Yeah.
So I'm trying to find what are some recommendations in this process of trying to find who I will fit with? Do I ask questions? Do I see 3 people cost my copay is $30 and I need to invest in that for the long haul? What are some overarching things to consider in the process of trying to find who's going to work well with me?
That's fair. So most websites, if you go to a person's specific website, they should have bios in all of those so they can tell you which orientation they come from, which I was saying the different theories of therapy. It also will tell you specializations in those bios, and you can see if people are aligning with who you are, what your belief systems are a little bit. I know that in the settings that I've worked in, there have been people from all walks of life and all different belief systems that are therapists. So if you're a person who's looking to have like a spiritual or religious based background, they should have that in their bio. And if they don't, I would say it's not a red flag, because some people just don't know how to make a website, but it should say something along the lines of spiritual counselor or LGBTQ friendly counselor, somebody who specializes in something like grief specifically. I would look for somebody who works with trauma and grief, like I said before, because of the situation and because of maybe why you're seeking counseling, but somebody that's going to align with you, because you want to be able to feel comfortable talking about your thoughts and your beliefs on different things. Now, even with that, they're bios, you know what I mean? Like, there are people who put things in there and you're like, well, they're absolutely not this or that. So I would say
like online dating. I'm sorry.
Yes, that therapist is not 6'1". They are not 6'1". They are lying. They have big old lifts in their shoes.
Sorry, let me stay back to where we went.
No, that's exactly what it's like. It is. And so when you go in for your first session, it should be 100% you interviewing them as well. So this is the problem. As a therapist, we're told not to talk about ourselves and self-disclose. But when that first session is going on, you're not going to be like, do you have kids? You could ask that question and they may or may not answer, because I've met therapists would be like, well, we're not here to talk about me. We're here to talk about you. Now, for me, when we're in school, they talk about the power differential that exists with therapists and clients. And for me, my number one goal when I'm working with somebody is to break that down. I want somebody to feel like they're talking to somebody in their life, not as a friend necessarily, because that's not ethical, but somebody who's going to talk to you as a real person and who's going to bring up things occasionally that are personal. I don't want them to be like, oh yeah, I lost my grandfather and it was so hard, but to say like, yeah, I've experienced loss and it is really difficult. Somebody who's able to relate on that level. And for me, if you can't tell, I'm a talker. So
that's where this is supposed to go. I'm supposed to ask questions to let you fly. That's what this is.
I know, but it's so funny because I'm used to just kind of sitting and listening and asking the questions, So it's funny whenever I enter therapy, I'm sure that therapists are just like, all right, it's time to sit back and drink my coffee because she's going to talk for the next hour. I don't have to say anything. So for me, I would say somebody who's going to let you talk, because that's what you really need. We're so used to sitting and listening that we need people who are going to allow us to talk and to feel what we need to feel. But like I said, there are different therapists. They have all different kinds of personalities. Some of them are going to challenge you. And if that's what you're looking for, ask them or tell them exactly that is, I'm stuck in my grief and I really need somebody who's going to challenge my thought process. And if you're willing to say those things, I think you're going to find the right person. So treat that first session as also an interview for them and how they're going to work with you in your grief.
Thank you. So I am a huge advocate for dealing with our mental health and our grief. For many people, this is the first type of grief that you've realized you cannot handle. Life presents us with opportunity to grieve in so many different ways, but we may not put that label on grief when my pet passes, or when I had my first breakup as a teenager, my parents relocate, I have health issues, I get fired from a job, or I have a terrible boss, on and on and on. Those are under, and I know you know this, but for the people listening, those are under the category grief. And you may want to sit down and say, what were my coping skills when I had that first breakup? Did I hang out with my friends and we went partying? I said there's more efficiencies and I masked that I was hurt? Or did I give myself time? Did I eat the gallon of ice cream? Or did I go to the movies? Or did I go, okay, that relationship didn't work? Was that them? Was that me? Did you self reflect? Or did you just try to ignore it and got you another boo and just kept going? If when you start looking back at all the griefs you've experienced in life, one, your resilience is a real thing, and you can see that you've been able to endure. But if your patterns of coping with that grief is now not sustaining you with the passing of a loved one, that's a reality for me to say, this is beyond me. And that's what I experienced. I had a miscarriage. We had a pet that passed. I was let go from a job before. I dealt with breast cancer myself, literally the year before Mark passed. But when he passed, I was like, oh, this a whole nother ball game right here. And my husband, late husband, Caucasian, so I'm in a biracial marriage. I need to have a sense of how a person is going to operate with me because they may see me as a Black woman, but they may be feeling some kind of way that this Black woman was married to this white man and we were together for 32 years. I need someone to understand, even though I'm in this grief fog now, I'm a retired Army officer. I'm not just sitting here waiting for someone to direct me. I have a sense of purpose. I'm a supervisor. I have a strong sense of my faith. I'm a mother. I know how to say no. I'm in a rough patch now. I'm not discounting who I've been up until now, but I'm in uncharted territory, which means I get to ask you questions. And I think people need to be okay with have 3 to 4 questions of what you want to ask to get a feel for this person, because they're about to be a very important part of your landscape. And if you are in a relationship with a mental health professional, you can't be honest. Why are you even doing this with them? Find somebody else. To me, it's like a hairdresser. It's like you give them the picture, you tell them how you want your hair, and then they do something different. I'm like, whoa, that is not what I asked for. And if I don't have that conversation, you're going to waste time. And time is something we know more than anything else, we have a limited amount of. And I thank you for being able to empower people to be able to talk and ask the questions about what they need to do when they're considering their mental health professional. I would like from different ways in which grief impacts our body, because I think people, they just think it's not doing everything to every part of you, and how that impacts you dictates how we show up in the world. And I think people discount how it impacts us physically, mentally, and spiritually. And that's why they sleep on the idea that they do need someone to help them in this process.
Yeah. No, I agree with you. So there's a book that I read called The Body Keeps the Score. I don't know if you're familiar with it. It's incredible. And it shows you how much the body is impacted by trauma and history and how we're feeling that on a daily basis. What I can tell you from a personal perspective is that, so my husband died on October 22nd, so that just passed. And what I can tell you is the minute that the weather started changing.
Hold on. Not October 22nd, 2024.
2020.
Okay. I just want, you said that fast. I want to make think like, she's talking to her now? Like, and she's,
no.
Okay. I just want
so
to.
4 years ago on the 22nd.
Okay.
Yeah.
Okay.
So I can tell you when the weather changed, I could feel my emotional, and it wasn't like I am getting old and my body is changing with the weather and stuff. But it was a profound physical and then also mental decline out of nowhere, to the point where I had to talk to my boss about it and be like, I just need to tell you that this is kind of going on. It wasn't something that was impairing me as a provider. I've gotten very good at like compartmentalizing when I'm in my office. Like the minute I hit my office, I'm a different person almost until like I get a text message. I'm like, oh yeah, I'm Jessica. And so it's not like a different personality or anything like that, but it's like right now, this is all I can be as the provider. But that I knew with the dates coming up that it was very likely I was going to be impaired enough that I would not be able to work on the day that he died. So I took that day off, and physically, trauma took me out. Like it was a slug on the couch kind of day because there was no doing anything else other than watching the memorial video from his funeral. There was watching I made a slideshow, but it's like from the minute that we meet all the way until before he died. And it's about 14 minutes long that I showed my kids every year on the day that he died. It's kind of one of our traditions that we do. And it goes through when I got pregnant with them and when they were born and all those things. So, I did the motions. I felt the things. I gave myself time to do that, but I still could feel that very physically. So when you're going through the grief and you are experiencing it, which it seems to peak for me at this time of the year, you have to make space for it and you have to make accommodations for it. And so talking to people who are important to know, it's important for them to know that you need that extra support or space for grief is super important. Like I said, I talked to my boss, and unfortunately, I just started the position in March. So the people I was with through the whole process, I'm gone from now. And so I had to go through the motions of telling her, but now I know that I don't have to do that next year. You know what I mean? And they were lovely and they sent flowers on that day and stuff. But like knowing that you have that support now, everyone is not that lucky to have a boss who is going to be supportive in that situation. But I would say setting boundaries is so important to overcoming the physiological effects of grief because you have to make space for it. And yeah, that's my take on it. But it
Thank
can
you.
do major damage. I was so sick. Like I read back on the journal that I made for my kids while he was sick. And I threw out my bat. Well, first off, I had a stomach virus. I had to clean everything because he was immune suppressed because he was doing cancer treatments with chemo. So I went to go clean everything and threw my back out, literally back to back things that happened. So I was out for that. And then right after that, I got a major respiratory infection that lasted. So like literally my immune system was shot. It was just shot. And so my body was not fighting these things that were happening just back to back to back. And it makes you then on top of everything, with all of the physiological effects, it brings down your mental health. So you're having this cyclical thing going on where your mental health is low, your immune system's low, you get sick, and then your mental health responds to not being well. And it's a cycle that just doesn't kind of end until something can kind of be put in there. So I hate to say this because it sounds so therapist, right? Like drinking water, exercise if you can, eat healthy. I'm not the best at that. But like, eat some vegetables or fruit, do something kind for yourself, provide self-care, which I know is such a buzzword, but doing something for you when these trauma points happen, just to help it. It's not going to stop it. It's not. Grief is a rolling ball down a hill. It's going to come one way or another. But I think you can slow it down with some of the things that you can do for yourself.
I would agree. I would just add this one thing and tell me what you think of this.
Yeah.
Oftentimes I hear people say, you have to do this.
No.
And we don't. And I think there's power in saying, I choose to do this.
Yeah.
Because we will connect with people who are choosing not to do any of the things that are recommended.
Yeah.
But the flip side of that, I've also found that those are the people that feel stuck more than anything else because they have determined hogwash to everything you're saying. Everybody loses someone, you'll just get over it. And I go, oh, okay, let me see how that works for you. And I try to consider myself like a car. Like if you were able to get your favorite vehicle, let's say, okay, it's going to be a Jeep Wrangler for me because I'm a Jeep girl. And you have your Jeep all set up the way you want. you're going to have your Jeep taken care of. You're going to get the service done. You're going to get your tires done. You're going to do all those things, keep it clean and do all that because you care about your Jeep. Our body needs to produce more cells to keep rejuvenating ourselves. That comes from healthy food. That comes from water. That comes from allowing it to rest. If you drove your vehicle 24 hours a day, 7 days a week, and never serviced it, it's going to break down.
Mm.
And when that starts happening to us as human beings, we're looking at the 1, 2, 3 things, like you said, to go back and look at everything that happened. This body is struggling to stay afloat, and we have to help it. And we just oftentimes don't see the value of some of the very simple things when grief starts grieving, to go for a walk. Doesn't mean you have to have money. You don't have to have a gym membership. And if you can't leave the house, you can walk in place. You can get up and move to a different room. You can read, to me, recalibrating myself. But if we don't do that, it hurts a lot. And I am 7 years into this journey, and I have remarried. But don't you know, a month ago, I received some documents about my late husband, and I thought I covered everything. I have a spreadsheet. I did stuff, da da da. Da. And it was like, well, you have to take care of this, and you need his birth certificate, his death certificate, his DD 214, and our marriage license. Just saying those all together just make me want to just
Crumble.
yes. But I had to go through all that, and I could start feeling like I was disassociating, that I saw myself being emotionally distracted. And I was like, "Ooh, we've been here before."
Yeah.
But I was able to start leveraging some coping skills. But the closer I got to wrapping this business up, it was more difficult. And then I received the final letter. I was on that couch after work, just watching TV and just letting, because my energy was taken by dealing with all of that. Now I could have just pushed on and done other things, but it would not have served me well. I went to bed at 7 o'clock at night, like two. I was
Good for
like,
you.
girl, but I had nothing to give. And grief does that to us.
Yeah.
And we serve ourselves better when we realize that and handle ourselves gently during that difficult times or these grieving seasons that we go through.
Yeah.
I want to say thank you for being willing to share about your husband passing. And there's the spoiler. That's part 2 of the conversation we're not doing here. But you want to go, but there's 4 because there's more to come. I won't say anything else about that. How has your husband passing changed the way you show up in or work in your mental health field?
Like I said, I think I try to compartmentalize a lot, but I know it has. It has impacted me. I think my ability to empathize with people who are dealing with grief is different. I can say that I had loss before my husband, tremendous loss. I also had a miscarriage, and that destroyed me for a year. Like literally took me down for the first, I think it was like our second year of marriage. And that was nothing compared to what's happened in this situation.
But hold on. What it
Yeah.
does say is the grief you're experiencing is the worst grief you're having. That seemed like that there. And then it's like, oh, we're going to upgrade your grief to something else. And it's like,
Yeah. I feel like somebody's playing games and I am not appreciating it. No, I mean, yes, they're all different griefs. And I hear the comparison of grief, and I think that it doesn't do a whole lot for us. You know what I mean? Like, I don't want to compare grief. I don't want to say, people who hear, I'm ADHD. Sorry, true diagnosis. So I'm not just saying it to but so I think that people have a tendency to compare because they want to be able to feel their feelings. And so even within the grief community, not to throw shade, but like we hear people talk about this too, is like, oh, well, you had to deal with a long terminal diagnosis, and that had to have been so hard to watch them get sick for so long and to watch them wither away and die. And then there's other people who go, oh my God, you lost your husband or wife so suddenly. I could have never have done that. You know what I mean? So we even compare
We
within
have that direct parallel. My husband, we were on vacation, he had a heart attack and died that day.
Yes.
And did they both die? I'm like, that's the problem.
Right. But like then we do it outside of our community, and is divorce worse than grief? It's just different. You know what I mean? So I want to say when it comes to grief and loss, whether it's I have somebody who their house burned down, all of their things are gone, all of their memories are gone, all their photos are gone. There's no external hard drives. That is an incredible grief that has to go on there versus my grandma died or my dog died. And I can see these extreme reactions to some of them that I go, but then I have to pull back and remember myself as a human and go, that is still an incredible loss for them. If they're having this response, it's because that's what they know is the most incredible, tremendous loss for them at the time. So I think if anything, my loss has humbled me in some way when it comes to approaching grief, because in the olden days, I remember there being some level, especially when my husband was sick. Because I will say very specifically, I remember a session where there was a child, and I'm sorry, I know this is an awful thing probably to say, but I'm going to be authentic because that's my number one goal in life is be authentic. I was in this session with a kid who lost a pet, and it was the most emotional thing for them ever. And I'm just sitting here going, my husband's currently dying of cancer. My husband's currently dying of cancer. And this is the worst thing that's happened in your life at this point. And I had to check myself really hard at that moment. And I have
something you said audibly. This is something you're thinking within your
mind. This is internally. I'm thinking to myself, I would never say that to anybody.
No, I just want to clarify. I knew that's what it was, but if someone listening, I want them to understand.
I don't want them to be like, oh my God, what a monster.
Exactly.
No, internally, I'm thinking to myself, like, how lucky that's the worst thing that's happened to you in life. And when those moments come, and I think that's probably why I'm more likely to be empathetic in this situation, is the worst thing that's happened. I've watched multiple different levels of grief in my life, whether it was the loss of all of my grandparents at this point in very different traumatizing ways in some situations, to my miscarriages that I've had, and then the loss of my husband. At that point, those things were the worst thing that had happened to me. So how could I have any concept of what it's like to lose at this level? And because of getting to this point of almost, other than something happening to my children, which if there's anything that will bring me to tears, it's that, I cannot imagine anything worse. Like I just can't. I don't know what it would be for me right now. My mother and I are very, very close. So I imagine that will be incredibly difficult for me, but this is all I know. But I'm able to reflect then on the past and go, but that's all I knew then is the worst pain. So I have to be able to apply that with my clients and with the people that I work with every day, because, and so I would say the loss of Jerry has put grief and loss in perspective for me, when before maybe I was slightly selfish, I think, in the way that I thought about it. I was, and I'm still a baby therapist, right? Like I was brand new. So I graduated in February, and he died in October. So like when I say these things, I was literally still just fresh out of college, not having a whole lot of experience. And at this point, I think I'm able to like pull back and do a little reflection, and you have to over time to be able to be a better therapist. So
it made you better at what you do. If I hear you.
Yeah, I hate to say that.
I'm just
it's so gross to say, but
it is.
But that's the case with so many different points of life, right? Like the question of who I am right now is a totally different person than who he married, and I am stronger. He paid all the bills, did the financial stuff. I took over that stuff. And I have to be more responsible, but it also, on an emotional level, I am responsible for my kids' well-being now. That is a tremendous, we can talk about that later.
Yeah. But so when someone is looking for a mental health professional, and they're fresh out of school, going back to relatable, is it okay for them to say, this person has not had enough life experience so they can be guiding me through much of anything?
Oh, I don't want to say that. I don't want to say that
But I
at all.
know a lot of people feel that way. That when they're trying to find someone, age and experience is part of their ability to say, how are you going to give me guidance? That's a
Right.
conversation I hear often with people.
So I would say the same thing is true with addiction and people who work with veterans is there's a lot of that conversation of how could I work with somebody who couldn't understand what I'm going through right now. So, but a lot of those people are fresh out of school and I can't judge a person just because they just got out of school. They've gone through their own life journey. I can't judge somebody based on the age that they're at when they start counseling. Like, I don't know if I would want to go to a 20-year-old counselor because they graduated early in school or something like that because they haven't lived life, but you're not going to find that really at all. What I will say is if you're looking for somebody who has been doing this for a while, you're going to want to look for extra letters. So it's different in every state. You're going to want to do a little research when you're deciding because every state is different, unfortunately, with how they label therapists for Ohio, where I'm from. What they have is LPC means that I am still licensed, but I'm dependently licensed, and I have to be supervised 3,000 hours in order to get my independent license, and I have to pass an exam. So you graduate, you take an exam to get your dependent license. Then you start, if you pass that, your 3,000 hours that are observed and you talk to a supervisor for a total of 150 hours out of that 3,000 hours. So you're doing one-on-one work, talking about what you're doing, how you could get better, all of those kinds of things. And then you gain your LPCC if you pass another exam and finish those 3,000 hours. So if you're looking for somebody who has the experience, who's going to be maybe a little more well-versed with time, you're going to want to look for extra letters. However, and this is what I tell people too, you're going to find cheaper rates with people who have just gotten out of school. You're also going to find people who have the most up-to-date information because they've just come out of school. There's new things coming out all the time, new developments. They're covering new topics in these programs so that the people are able to address issues on a regular basis. So there are benefits to both situations. And I have also, I don't know if I should say this, I have met really jaded longtime counselors who think
I
that
think
they
that's in any
know.
profession. So I'm just going to say that's in
Yes.
anything that someone does. They may lose their spark, their emphasis in doing that because
Wow.
they've been burnt out, whether it's someone, a first responder, a teacher, military. Sometimes the thing that you do can wear you down. So I would expect it
Absolutely.
to be in this career path also.
Yeah, and I would say so I don't know that it does matter. I think you, like I said, go back to the bio and see really what they're passionate about and what they want to make an impact on in their own profile. But again, that's only what they're putting in there. So it's challenging. It is not easy to find somebody who's a perfect match for you, but yeah, those are kind of the guidelines that I usually tell people about and how hard it is. It's like a sliding scale of trying to figure out the right fit.
Thank you for providing that because people often are only seeing it one way.
Yeah.
And so I would ask you this. Have you connected with anyone professionally or personally that has decided mental health assistance is hogwash, but their grief is showing that it really is necessary? And how do you manage those conversations?
Are you talking about in real life?
Yeah. This is not someone that came to your office, but this is you bump into the grocery store. Well, let me say it a different way. I bump into you in the grocery store and we happen to start talking because I saw your nails were cute. And then we started talking about this. And then
Yeah.
we happen to both talk about that we lost our spouse. But then I talk about how I've started isolating. I don't trust coming outside much. I've been drinking a lot. And I feel like God took my husband as a personal attack. And I don't want to do any therapy because what are they going to tell me? He's still dead. What would you say to me?
This is tough, right? Because if you're not open to mental health therapeutic services, they're probably not going to work super well for you.
Mm,
And I'm not saying that you have to have a buy-in when you first start. I think you can gain that over time, but you have to have some level of buy-in in order to get your butt off the couch, out of your desk chair, wherever it is, and get to a session or online. By the way, I was going to recommend this earlier. I did all mine online. It was the best thing I've ever done because I
I
didn't
see
have
my therapist online.
Yeah.
We were in person, then COVID happened, and he started doing virtual. I was like, one less place I got to drive. Yes, I'm here.
It's lovely. So like, I hate to like throw out because I don't want to like recommend anything, but like the BetterHelps and all of the ones that are out
I'll
there.
just say virtual is
Just
is a
virtual
wonderful
is
option.
it's really good. And because of the fact I literally graduated, got my license a week later, and the world shut down from COVID. So what I can tell you is the majority of at least younger counselors are still offering telehealth as an option. If a person doesn't have some level of buy-in, most likely they're not even going to get to themselves to a point that they get to an appointment. For me, if I'm hearing something because I'm brutally honest with people, I'm never going to say anything about you that I wouldn't say to your face. Like that is my number one goal in life, is to always go with that approach, is telling them like, I know that right now you're going through a tremendous amount. And I can't imagine what you're personally going through, even though I know on my level what I went through with grief. But the only thing I can say is I know talking about it helped. I know you don't want to necessarily be helped, but maybe just talking about it, getting it out there. Because I think personally for me, and it's different for everyone, embracing my story, telling my story over and over again through TikTok, through therapy, and TikTok was its own therapy, honestly. Getting my story out there, talking to my friends, talking to my family, people knowing what has gone on, because we were very secretive during his treatment, other than what we put on his caring bridge or whatever it was called.
Yeah, Cambridge, that's what I used in my cancer journey.
Yes. It was great, but like, you see a snippet. It's like a bio for a therapist. It's a snippet versus the ins and outs of everyday life. And the more that you own your story and what's happened, the more I think you're going to heal. But I think a lot of people gloss over. I think a lot of the controversy. I think a lot of people that get stuck, not necessarily always, are either stuck in two places, which is the halo effect, that their significant other is just the best and no one could ever compare to them. And so I'm going to glorify them at all levels. Or there's a guilt, which is I feel bad that this is how it ended. So I'm going to live in my guilt and my grief forever. And it's really hard to break through those two approaches to grief, because there is such an ingrained version of that in ourselves, in our grief journey. And so if we get those people in front of us, it's a miracle. It's the people who go, I want to see some level of norm appear again. If you're invested in finding some level of norm again, you have to invest in telling your story, and you're not going to do that unless you get in front of somebody who's going to listen, and listen with unconditional positive regard, which is what we go for with therapy, is that this is your experience. I'm not going to tell you what your experience should be. Have you thought about looking at it this way instead, though?
Why is it so powerful to share the story?
Yeah. Yeah. I think, I think embracing your story is embracing yourself.
Okay.
Because especially if you've been a caregiver, it hasn't been about you for a really long time.
So a
It's been
caregiver
about the
may come
person.
into this with different things than someone that was not, that
Yeah.
need to be addressed. Okay.
And I would say the same for you with what happened for you, is when we lose our person, people grieve the loss of their person. They'll feel for you for a minute and then they move on with their lives. They remember the lost person, right? As they should, but they don't realize the ripple effect that's going on for the rest of our lives for the people who were directly impacted on that loss. And so I think embracing your story is embracing what you haven't gotten to tell, and what people don't necessarily listen to or think about on the daily. You get to embrace your own story in grief and own it, because it hasn't been a factor in all of this. It hasn't been people's first thought. So I think embracing your story does that for yourself. You get to own and be the main story in this situation, instead of the whole focus being around the person that was lost. And I think that's necessary on some level.
Yes, I would totally agree, because now the rest of this is really about you. And this is not about being selfish or inconsiderate. This is you now trying to figure out how to live the rest of your life without this person being there. Their journey is complete. They are done with this human experiment that we're going through.
Yeah.
Now, the grief does become about us because it's our lived experience. I would 100% agree with that.
Yeah.
I want to shift to the area you're working in now. Adults generally know how to communicate. Adults can articulate, do something. A child that is going through trauma and grief, they're still just trying to develop into a human being. And a lot of times have been put in places where you're seen and not heard, or not as valuable as an adult. How does one approach, and this is a broad scope, a child that is grieving or dealing with trauma?
So I work with 12 to 14-year-olds most of the time, maybe an occasional 11 and 15-year-old, depending. So a lot of them do have some sense of what their experience has been. But it's kind of like, was it Mad Libs that would have like the whole paper and then there would be little sections out of it and you had to add like a verb here and a noun there.
Okay.
You know what I'm talking about? So it's sort of like that for therapy is what you see if you're dealing with grief and loss is I know what happened. I know I don't feel good about it, but I don't know how to say exactly how I'm feeling. So giving them the tools for what do those emotions look like and how are we processing the feelings, and is that engaging then in a different action or behavior than what we really want to have happen. It sounds very clinical, but I swear it's not like in real life. But giving them the tools and giving them the words to be able to express themselves is number one. And I think we need that as adults too. Especially that first year, you're super, super numb and you don't even know how you feel most of the time, except for you felt 30 different things within an hour or a minute, and it's constantly shifting. So how confusing for a child who can't even put one word other than angry. I'm angry all the time. And I go, I hear you, but anger is a secondary emotion. It is not the first thing that we feel. So we have to look at our emotions and think about what was the first thing that we felt? Do we feel alone? Did we feel isolated? Did we feel unwanted, unloved, not taken care of, or abandoned? Like, what feeling did we have before we got to the anger point? Because we really need to look at those feelings that get us to the anger point to stop whatever action might come from the anger. So it's the same work. It's just a little bit more than we would have to do with an adult that kind of has some vocabulary that would already suffice for understanding what their emotions are. But I think it's all with grief and loss, a mixed bag of emotions that's hard to like pick which one you're actually feeling at any given time. So it's mainly a vocabulary increase in understanding how that's impacting their feelings overall.
Yeah, I can see that.
Yeah.
As a parent or a caregiver for a child, what are some things that may allow me to see they're doing more than just acting out? There's a bigger situation that needs to be addressed.
So I go with the theory of, is it impacting them on a functional level? Because when we're making any kind of diagnosis, we have to look that there's a functional impact that's being made. So is their inattentiveness causing them to not do well in school? Is their anger and aggression causing them to lash out at classmates or teachers, or not just at home, but also at school? We need to see that there's a functional impairment in multiple settings and that it is causing some kind of issue. Now, we're going to see our kids throw fits and be upset after the loss because of that confusion that we talked about before of not knowing our feelings and our emotions. We're going to have that happen no matter what. But when those start to bleed into other situations at school, you have to go pick them up frequently. They can't calm themselves down. And it's happening repetitively and not just once every couple of months that this is going on. Frequency, level of functional impairment, and that it's happening in multiple settings. Those are the things that I look for as a practitioner. As a parent, I go, oh, one thing happened, I don't know what to do. But like as a provider, I can say that's what we look for as a major difficulty for a person or for a kiddo.
But you actually did slide into my next question.
Yeah.
And this may be Jessica the mother, Jessica the provider, and trying to come in the middle, handling your children's grief and managing that. What does that look like? And what are some things that can help parents dealing with that?
Okay, so I at least took grief with my own kids at the same level that I took mine, which is to hold space for grief as often as we need to. I may have gone a little overboard at different times. So they have a blanket on their bed with pictures of just them and their dad individually. They each have, well, so for Jerry's Father's Day, right before he died, I made a book from the kids to him with pictures of just them and him. So they each have their own daddy book is what I call them. We'll read those at night. I have pictures up of them and their dad, a lot of them everywhere. I don't take those down. My son is the spitting image of my husband, and I tell him frequently, oh, that's exactly how your dad did this, bringing him up in conversation, trying to keep his memory alive as much as I can without idolizing him, because I also don't want them to look at like, oh, I have to be great just like dad. I want them to know he was a human, but I'm not going to talk shit on him. I'm not going to do that. But what I will do is like say, your dad, so he had dyslexia, I have ADHD, my kids deal with a combo of different things. And I go like, that's just like dad forgot this, or I always forget things too, and humanize as much as I can the experience that they're having. And letting them be upset and not telling them to be a man, buck up, for girls, telling them to suck it up. You're just throwing a tantrum. And if they say, I miss dad,
when they say
it, you're going to probably notice different patterns. It's always at night for my daughter. It may be because of the daddy blanket, maybe because of the book that they can read whenever they want to. We don't read it every night. It's not that kind of a thing. Their memories come up at night when they finally have time to think. And I think it gives them time to think about their dad. Give them a hug and say, me too. What are you remembering about dad? What do you miss about him? And it's really tough for she's 7 now. She was 3 when he died. It's really hard for her to recall things. A lot of things are things that she's seen on video or pictures. But I think even recalling those things allows her to try and heal and to have some membership into the grief. You know what I mean? Like, I think she's very confused. I think at some point she will get to a point that the only thing she remembers are things from what we offer her. But I will always offer those things to her because I don't want her to feel like she doesn't have a right to the same level of grief as us because she still lost a father. So I think not identifying, but acknowledging the grief that our kids have and to be supportive, even if we think that they might be using it to get out of going to bed on time occasionally. Like it has happened, but like
they know how to go. I think I got her.
Yeah, they have. Yes. And they get in trouble and I miss dad. And sometimes you can see the connection and sometimes you're just like, nah, dude, you messed up here. Like this is a you issue.
But that's important to know that it's not always that. No, yeah, you're playing me. We're not doing that today.
Right. And it's hard to tell when that happens, but you'll start to learn.
Because you're in your own grief too and trying to. Yes.
Yeah. But to acknowledge and to say like, yeah, buddy, I miss dad too, but I don't understand why you just tried to do this. Like, and so, acknowledge the grief, never dismiss it fully, but we know they might be utilizing that just to get away with this, but to say, yeah, I know, like, of course we miss that person, but like, I don't know why we're doing this. So yeah, trying to keep his memory alive is one of my number one goals. And even with my marriage to my new husband, we had a board.
Okay, so you can't be getting into the next episode.
Okay, it's a teaser. Come back. Well,
okay, go ahead.
We had a board. We have a board at our wedding that may or may not have happened. That had initials from our significant others that we lost, and then also all of our grandparents' initials on there that we did a board. So we want them to be present even in that moment. Like there's always a need for their memory to be alive because it's the same as when we like hearing somebody else bring up a story or a memory.
Yeah.
It makes us remember that they were real. and that they weren't just here and gone. And we need to remember them. And so I think us bringing it up as often as possible is 100% necessary.
The idea that they are real.
Yeah.
It seems like, well, of course they were, but when your person is no longer here, and it's like, did I imagine all that? Like, we did
Yeah.
do this. We had these experiences. I mean, I'll open the photo and be like, yeah, that's what because time will play with your mind to go, it really wasn't that.
Yeah.
And it's like, but I thought it was. And you
Yeah.
have to go back and recount those memories. It is so important. Thank you for mentioning that.
Yeah.
In the work that you do, is there a particular reason why it's split up to the age group of 12 and 14? Is there something cognitive with adolescents, or what is the
No,
logic?
I'm at a middle school, so that's just is kind of the population I work with the
Okay.
most. But I've worked with kids as young as 4 in the past, which is very, very difficult. And then I have worked with adults who are in their 60s and 70s. So I've worked with a variety of different people, but the majority of my practice has always been with younger kids
With
and
the
adults.
4-year-olds, for a parent dealing with that, what are some things that are difficult that they need to consider or be patient about?
Oh, everything, because they don't have the verbal capacity to express. Everything's going to be just feelings and confusion. And so working on if you're not thinking, it's hard to find a therapist that's going to work with somebody that young. So if you can do sort of the research a little bit and see the need for verbalizing their feelings, teaching them those vocabulary the vocabulary that I was speaking about before. This is how I'm feeling. I miss this person, offering them. I've seen dolls with daddy faces on them, and letting them talk to that doll. I know for us, we also, along with me doing individual therapy, I also did group therapy with Fernside, which is through the Hospice of Cincinnati. And so there were groups of different age groups. So they had very, very young, I think 3 was the youngest that they went, and giving them people who they can understand with or understand the loss with. And some of those kids lost siblings or grandparents, but there were a lot of kids who lost parents, and letting them know, like, yeah, there are other kids who feel this way, because imagine being shoved into a school and everyone else has a parent that goes to this or that, and you don't have that anymore. So letting them feel like they're part of a place that they have that support, I think is really positive, as well as just keeping that space open for grief, and knowing it's going to look different, and there's going to be like outbursts. There's just because they cannot verbalize it, and they feel as overwhelmed as we do in that moment without any ability to say anything about it. So it's challenging, but I think making the space was very helpful on our end, and letting them
Mm,
know it's okay to talk about them.
thank you. So, as Jessica has dropped all of the spoilers, our total series of conversation is this is the first one with Jessica sharing from her experience as a mental health professional. Our second conversation is giving Jessica space to talk about Jerry, her grief, their family. The third conversation is with her now husband, as he is a widower. And then our fourth conversation, we'll have the both of them together having a conversation and talking about that experience. So you want to catch all 4 of these conversations. As a parent, and I know this is going to be as it relates to you in Ohio and the school system in which you operate in.
Mhm.
What are some services that people may not know about that exist in the school system, and how do they find out about?
Yeah, so you definitely want to reach out to your school counselor, and make sure that you're asking them what resources are available. For my kiddo, their school district is fabulous. They have, so it's not through the place that I work for, but it's through another agency who does something similar. They have in-school therapy, which is about 30-minute sessions. For ours, it's like 30 minutes to an hour. So many of the school districts that you may reach out to will have individual therapists from different places. There's usually wait lists, but if there's something significant like this, significant like a death, trauma, grief, then they may get high priority so that they're closer to the top of the list to get pulled faster. So there may be an individual therapy. I know for our school system, they have emotional support animals that can come by, dogs specifically, and visit the student. The day after my husband died, they allowed for the emotional support dog to be with him the entire day, and he still talks about it. He was 6 then, he's 10 now, so he remembers that being available to him, and being like, "Oh, I want to see this person," I think talking to their teachers, letting them know what's happened, to be sensitive to the situation, super important. School counselors to have a regular check-in. I know that for my son now, they are offering through the middle school a grief support group for people who have lost people. We are very, very lucky to be in a school system that have the resources that we do. You may not if you're more in like the country area where there's not as many resources available, but for us, we're right outside of a major city, about 30 minutes outside of Cincinnati. So there are resources that we have available, but I wouldn't have known about them unless I was a teacher. I was a teacher for 7 years and then went into mental health. So I knew that there were some resources that had to have been available. So reach out to your school counselors and then always notify the teachers so that they can be like a huge presence for your kids. And it's been 4 years, but my son still talks about how much he loves his first grade teacher, who was a huge support for him. So, good teachers are going to make a huge difference as well, and understanding teachers.
Thank you. So we have to tell them it's happened for
Yeah.
them to know how to assist us. And we
Yes.
have to ask the question, what services exist? How do I get a list of those? What do I find out?
Yep.
Because the death of our person destroys our world, and we assume that everyone else knows. And we cannot make an assumption that they're aware. We have to convey this to them so they know how to show up for us.
Yeah. And I hate to say this as a generalization, but we kind of have to do the same with everyone. We want people to just show up, and they might for a little while, but when it stops, asking for the help is so, so necessary. And we're stubborn. I'm probably one of the most stubborn people you'll meet. So asking for help is not easy, but when it comes to the schools or friends or family and you need them, you have to say it. It's the only way that we're going to get the assistance that we need. And it's not necessarily that they're always going to say yes, but at least you've put out there that you are in need of something, whether it's time or help or whatever. We have to be willing to ask for it,
Mm.
because we can't expect them to mind read as much as we want them to be able to.
I
We
think
want
it's
them
just
to
so
be
hard for us to say we need help and the constantly my person died
Yeah.
and da 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 da. And
Yeah,
that is draining.
it
I
is.
I have asked you a lot of questions. Any questions you have of me or something thinking of?
Yeah. What do you think is the most important thing for you with a therapist if you're looking for one? I don't know if you were saying it theoretically or if you're really looking for somebody, but what are you looking for the most with somebody who's a mental health provider? Like, what is the most important aspect of it for you?
I am not looking for one. I'm fine with who I have. The first mental health professional I worked with, I saw them the day before I viewed my husband's body for the first time.
Mm,
And I was not thinking I needed a mental health professional, a therapist, but another widow that I knew called me and she said, Tina, I am so sorry. And I cannot attend this funeral. I was like, girl, I don't want to attend. I don't know what you're talking about. Like, I don't want
right?
this ain't what I want to do. But I understood at that moment how difficult that could be for her
Hmm.
being fresh in this journey and not wanting to make my husband's passing about her because how it would impact her. So not being there was a choice she made. But she called me and she said, but I have reached out to my therapist and she will see you whenever you want to see her.
Awesome.
And the light bulb went off like, oh, this is uncharted territory.
Hmm.
Like, you go to school for your career. You take training for different things. When we were preparing to have children, we read books and we did things. I'm about to be a widow. Not about to be. I at that point, I'm a widow. I don't
Mm.
know what this is going to look like every day. I have no concept of how this is going to impact me mentally. And just and she just said that, and it was like going, yeah, girl, this you need help. And I hung up and called that person immediately, and they saw me, And I was like, I'm so glad I didn't try to do this on my own.
Yeah.
This, I had no concept of what was before me.
Mm.
And that let me know that was a good choice. It
Yeah.
gave me space to validate how I was feeling. It gave me space to understand healthy and unhealthy coping skills. It was a good interaction. I think the only part that I kind of maybe made the therapist upset about, I self terminated about 9 months in,
Mhm.
because to me, the conversations were repeating. I was having an issue. She was giving me the same coping skills. I'm working it out. My husband was important to
Mm.
me. And I didn't want to now tether myself to someone else to be my anchor. I needed to be my own anchor in my relationship with God.
Mm.
So I needed to say, let's start moving this out a month at a time, 2 months at a time, because I need to know I can stand. You've given me the information. We've done all of this. I have to learn how to life. And we shifted, and then that part was over because I relocated from Pennsylvania to Virginia, and Mark passed in 2017. Virtual was not a thing at that
Yeah.
point. When I moved to Virginia, because this is a place that we were looking to relocate, Mark had actually found a job here, and I went to undergrad here and have a really good support group, and it's warmer than Pennsylvania. Let's just be honest. There's the snow and the oil bill, all of that. And I'm functioning, I'm in grad school, I'm just doing seminary. And one of my friends came over and she came unannounced and she says, "You're not talking." And that's a problem. And I stood at the door and just started crying. And I said, "This is so ugly.
Mm.
This is miserable." And she goes, "I'm not afraid, and you're letting me in the house, and you're letting me into this situation."
Mm.
I thought I was okay. I realized I was a functional griever, like I consider like a functional alcoholic. I was
Mhm.
going to work, I was doing stuff. I'm in seminary, da 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 da. But I thought I had checked the block, and we have now put grief in this space, and we continue on with life. Oh, silly child I was. And I was like, there's still more work to do. And I one, my insurance needed to cover it. That was important to find somebody in network. I needed to find somebody that looked like me. I needed to find somebody that was an African American, because my journey in life was different than my husband's journey of being a white man in America. What he would resonate with is going to be different. I did need somebody that shared my same faith, because that is a principle to how I live my life. So
Mm.
if I'm looking for you to give me guidance and direction, I need that to be in line with core parts of who I am already, that
Mhm.
will help wrap around this experience of grief that I am now going through. Didn't care if it was a man or woman, those things that matter to me. I needed someone that I felt was respecting me, because I know sometimes in this world, being a woman, we are thought less than. I need to pick up on that and see if there's value in how you see me.
Yeah.
Everything else, education, background, how'd you get into this profession? Why are you doing this? Those sort of kind of basic things, those were the items that I looked for as I was looking to see who would go with me on this journey.
Yeah.
And I moved here in 2019. I had been seeing my therapist. We started out weekly, then we moved to bi-monthly, and we moved to monthly, and now it's like quarterly.
Yeah.
But I think I probably will have a therapist just like I have a dentist or anybody else. The stuff that goes on in this mind should not just be on it shouldn't be unhinged. There needs to me a space to check in and do different things. And I believe there's more strength in acknowledging I need assistance versus trying to wing it on my own and making a hot mess of it all.
Yeah. And always be willing to go back, because a lot of people feel shame with therapy services. And if they've completed or discharged, it doesn't matter. It's okay. We
Yes.
are a constantly evolving human being with changing or like feelings all the time. And so it's okay to admit to ourselves, like, oh, I'm back to here. I think I need to go have a check in. And whether that's, one or two times and then you're gone again, I would rather you come and talk to me any day of the week than for you to have to sit with those feelings and not be able to express them to somebody. And I think again, it's different for every therapist, but I think the majority of therapists are happy to welcome somebody back who needs those check-ins or needs to restart therapeutic services in general. So I think that's brave if you go back after you've left therapy and to go, I think I need to come back for a little while. I think it's super brave of somebody to do that.
I would agree. And I want to circle back to something you said about shame. I
Yeah.
have felt in my community the need to have rigor and resilience doesn't serve us well when we have to come to terms with the reality of where we feel weak or vulnerable
Mm,
because shame could be implied. Well,
yeah.
it's going to be more shameful if I fall apart and I'm not given space to honestly deal with this traumatic situation I'm experiencing because you want me to brush it underneath a rug and just keep going and moving forward. I am falling apart and I do not have time for your validation or your approval. I am crawling through volcano ash as
Mm,
more volcano ash is coming down and I'm trying to live. And when you are in this space and you realize how difficult it is, and you say, yeah, I need some help. I don't care what other people say. I'm trying to survive.
mm,
That's where I was at, and I could care less about what someone else said. But I had people go like, "You're seeing a therapist? Like, you're in the army and you were this." I said, and he still died.
yeah.
I was there when my husband had the heart attack. And trigger warning, I saw his body shaking and convulsing and calling 911. I was at the end of the hallway, scantily dressed because we were in a hotel and watching my life fall apart. That
Mm,
played in my mind every day driving to work.
mhm,
We're not toughing this out. We're going
yeah,
to figure out how the brain works to understand, oh, that I'm in fight mode, that my prefrontal cortex is like going, we'll see you later.
yeah.
And
Bye.
and my amygdala is going, oh, we're in charge.
Yeah.
Knowing those things empowered me to understand why I was feeling this way. This
Mm,
wasn't some random act. There are scientific things that have been evaluated and proven. Me having that knowledge of saying this is how that I will be sleepy, I will be tired, the grief fog and brain, that type of knowledge helped me to go, this is something that is normal. Grief
yeah,
is a normal experience and it should not be brushed away.
yeah,
And so those things were helpful for me.
yeah. Find somebody that can crawl through the ash with you. That's all I can suggest. Find somebody who's gonna crawl
Volcano, as the lava's coming down and you're still trying.
and then they shove you down the hill. No, get somebody who's gonna walk through hell with you because that's what you need to find.
Yes,
When you can't do it, that they can be the strength, hopefully on some level, to push you to get to walking when it gets to the point that the magma's coming, you gotta start walking, And so find somebody who will crawl through hell with you.
and that is why I actually do what I do with Widowhood Real Talk with Tina, because there are so many people that are isolated. They feel alone. They feel like nobody cares. And why I am constantly creating community, if it's with our grief Discord, a private Facebook group, or the TikTok lives, because this is hard.
Mm,
I will never tell another widow, I know how you feel, because I don't know how you felt in Jerry's passing.
yeah,
I know I was with Mark for 32 years. I know how I feel losing him, but I was a unique individual married to this unique man in a unique relationship.
yep,
Are there some similarities? Can I empathize with you? Can I feel? Yes. I can be standing here holding a rope as you're crawling through the volcano ash and the lava, everything coming down, but you've got to do the crawling.
yep,
You have to do the work. I can be there and stand and hold as you're doing all of that. And that makes importance to be able to say, okay, this is messy, but there are other widows and widowers who have learned to continue living a life. And getting recoupled is not a resolution for grief. That just may be something you choose to do.
It is not.
But learning to live again and be happy and find joy in the life and realizing how precious it is. We need people to sometimes to help us do that.
Yeah.
And that's what these conversations are for people to know they are not alone.
I love that.
Thank you for being here in this conversation. I'll allow you to close this out. Maybe there was something you wanted to share that we didn't talk about, or just overall wrap up this conversation.
Yeah, I would just say exactly what I said before is, when it comes to mental health, everyone is different. Everyone's looking for something different when it comes to mental health. Make sure that you're advocating for yourself. Make sure that you're finding the right person to crawl through the ash with. And you can only do that by asking the questions that you need answered. Don't feel embarrassed or ashamed. You have to have an idea of knowing what you want and going for it, and finding the right person to meet your energy in that situation. So keep on searching. I hope that you find the right person, because I'm guessing that they're out there somewhere. And if you're still debating on whether or not mental health is right for you, it's right for everybody. It's just that it takes people making that decision for themselves to do it. So don't feel embarrassed or ashamed. Everyone should have therapy, including therapists who do have therapy. So know that when you're making that decision. I know that's simplifying it a lot, but you can do it. You can do it.
Thank you, Jessica, for being here. And thank you, everyone, for being part of this conversation with us.
Thank you, everyone.
See you on part 2.
See you part 2.
Thank you for spending another episode with Widowhood Real Talk. If you found the contents of today helpful, share the episode to anyone you know who may need it. Subscribe to the show and tune into Widowhood Real Talk each week. Then visit widowhood-realtalkwithtina.org to join the community and access additional resources. Remember, you are not alone in this journey.